Hey everyone, it's Michael here at Home Health Success Academy, and you are watching our home health fraud video series where we share with you guys some of the fraudulent activities that are happening in the home health industry and how to make sure that you can recognize it and avoid it for your particular company. So in this video, what we're going to talk about is nursing visits, okay, and how this can unfortunately make an agency commit fraud, okay, knowing or not even knowing. All right, so let's get started. So your nurses, they visit a patient. They provide their services. Your therapists, they provide their services. They have to visit the patient. Your home health aide, they then go visit the patients. Now, this is something that has happened a lot and is actually, you can research it and figure out which companies have committed this already that's been caught. So a lot of nurses out there will go see a patient. Of course, we have to make them sign a particular paper that we did the visit, right? This has happened before we started having a lot of the cloud-based systems out there. And so what it is, they'll make the patient sign these papers with the patients unfortunately not knowing that they're signing, future visits. So that when the nurses turn in their paperwork to the facility, they can say, yeah, I visited the patient this day, this day, this day, this day, this day, right, to get paid for that. But the truth is, the nurse probably visited the patient twice out of the 12 visits that she should have had, okay? And so what happens is there's several people that loses here. The patient loses here, right? The government loses here. The agency loses here. Why? Because if that is found, they can be gone after as committing fraud because they billed for these visits that were actually not even done. So this right here is such an important thing. Now, there's a lot of softwares out there, like our new billing softwares and CRMs out there, who created a software that allows you guys to make sure that the nurse actually was with the patient. That the moment the nurse sees the patient, they can check in. When they leave the patient, that they actually check out as well. And there's what we call map stamping, where it can literally position you GPS-wise where you were when these things were signed. And this is where it's important for you as an agency to track your nurses. And yes, it costs a little bit more money to have this in, as an add-on for your software, but it's also a security for you to make sure that you're doing the right thing, okay? There's some agencies out there also where they find out that the nurse missed the visit and they'll still bill for the full visit so that they can maximize the billing. And some agencies will just say, well, let's just make up for it and do an extra visit later on. No, you can't do that, okay? You must make sure that you do it correctly. When the nurse visits the patient, that's what you chart on there. Do not allow yourself to step past the boundaries of ethics just to justify to be able to make money, okay? So you guys have to understand that as an agency, you need to be able to make sure you watch your nurses. Number one, that they're visiting the patients, that you can track those. There's so many companies out here nowadays that you can use to track your nurses. And also, the nurses should also stay with the patient for the maximum amount of time that they should be staying, right? There's also nurses out there that will stop by a patient and see the patient for 10-15 minutes and that's it, okay? No, you're cheating the patient. We're trying to make sure that that they actually get the full service so that they can actually maximize their care and their therapy. So we can't see a patient for 15 minutes when we should be there for an hour, okay? I've heard stories where a nurse will go to a senior facility and do a group visit and have 3 or 4 patients being seen at once and talking to them as a group and thinking that that's one visit for every single one of them. Okay, so there's so many horror stories going out there, but you guys need to make sure that this is not occurring. Okay, you must provide the visit. You must bill for the right visit. And at the same time you need to be able to monitor your nurses that they're actually doing the full visit. Okay, so this is one quick video that I wanted to discuss with you guys. I hope this was very informative, and the reason why we give these videos is for you to avoid facing these type of problems in the near future and how to be able to correct that properly. So how do you correct it? Get a nice software where you can actually tell your nurses that, hey, We're tracking you during this visit. We know where you are when you leave. The next thing is this. Make sure that your nurses are actually doing their charting when they're with the patient and not charting when they actually leave the patient's house. Okay? Because the reason why is this, they may forget everything that they've done for that patient if they think that they want to chart later on. So make it your policy that when the nurse is charting, she's doing it during the care of that particular patient at that given time. Okay? And a lot of nurses are against this sometimes, and you tell them this, you're just doubling up your work because you're going to end up at home doing the charting, and you're pretty much going to be doing both when you can do everything at the same time. So it's time management as well. So I hope this video helped you guys out. This is Michael with Home Health Success Academy. Always know that home health marketing is easy when you know what you're doing.